Okay, next bill up before us is House Bill 809. That's the Hospital Violence Protection Act. Okay, and that would be Representative Reeder and Representative Purtle. There is a PCS on this bill, and without objection, Representative Reeder moves that the PCS for House Bill 809 be placed before the committee for discussion purposes. Representative Reeder, you are recognized.
Thank you, Madam Chair and members of the committee. And also thanks for my sponsors, for Representative Miller and Purtle, who've helped me on this bill. I'm here to ask for your support for House Bill 809, the Hospital Violence Protection Act. This bill helps to address the growing problem of violence against healthcare personnel and hospital personnel. As you may not be aware, violence against healthcare workers is growing at a crisis level. When medical staffs are faced with this level of violence and disruption, it doesn't allow us to provide care to the patients who need our full attention. It also contributes to burnout and is also a contributor to the workforce shortages that we're facing across healthcare. According to OSHA, healthcare workers account for 71% of all non-fatal workplace violence-related illness and injuries. This makes healthcare workers the most dangerous occupation, believe it or not. This caring profession has more injuries than any other industry. Healthcare workers are 4 times more likely to experience violence at work compared to other industries. From a recent survey of my physician peers in emergency medicine, 66% suffered a verbal or physical assault in the prior year. Several years ago, the General Assembly increased the penalties for assault on a healthcare worker and emergency personnel. We know that these assaults happen on a daily basis across North Carolina. Unfortunately, over the last 4 years, there have only been on average 20 charges and 30 convictions for assault on a healthcare worker across the state. Violence occurs throughout the hospitals, but it disproportionately happens in the emergency department. This is resulting from staff shortages, mental health issues, lack of treatment facilities for mental health, ED boarding. This bill isn't a solution to the whole issue of violence in hospitals, but it begins to address some of those issues. And the bill asks for really a few things. First is that each hospital who has an emergency department develop and implement a security plan to address violence. Although there are some standards for hospitals related to safety, most of them relate to patient safety. It doesn't relate to the staff safety and violence towards the staff. Another part of the bill is to require at least one law enforcement to be present in the emergency department or on the campus at all times. This will help increase reporting of events, help with arrest, prosecution, and to protect our healthcare workers from violence. We've talked about the crisis of mental health, and that is an issue, but what we see in emergency departments all the time is not violence from patients who are suffering from mental illness. We see violence from families and staff and other people towards our staff from other people who are just visiting who are unhappy with what is going on. So a law enforcement officer at all times. We've had discussions with the Healthcare Association and about this requirement. The cost is a bit of an issue, but really the bigger issue is making sure that we have the availability. As you all know, that law enforcement officers are in short supply right now. So this does give an additional year for this implementation. Finally, we asked for a report back to the Oversight Committee about the charges, convictions, the incidents of violence in healthcare hospitals. And I would ask the committee for support of this important issue, and I'm here for any questions.
Thank you, Representative Reeder. Are there any questions or comments from the chairs?
Okay, I have one.
Chair Lambeth, you are recognized.
Representative Reeder, thank you for bringing this bill forward, and I agree with you. This is an issue that needs to be addressed, and I think you've approached it with your background in a reasonable way. I do have a couple questions. I wondered if the Joint Commission that accredits hospitals, do they not address this area at all of security?
Thank you.
Representative Reeder, recognized to answer the question.
Thank you, Representative Lambeth. There are standards from Joint Commission, but most of those deal with safety of the patient, and they don't really get into address how do you protect the staff from violence, especially for non-patients. And so I think that that's why this bill is important.
Follow up.
Follow up.
only other question I had was about the cost. It would seem that obviously all the big hospitals, even the mid-sized hospitals, they're going to have security is not an issue. And the ones I would worry about is the really small rural hospitals that are already struggling, and adding the cost of an officer 24 hours, 7 days a week could be an issue, particularly those off-hour shifts. And that's the way I read this bill. Is that a correct interpretation?
Yes, it is. One of the things that in working with stakeholders is that we've created some language for hospitals that have done their assessment and don't feel like there needs to be an officer 24 hours a day. Let's say the police station might happen to be right across the street. If, when they've done that plan, that they can ask for an exception for that law enforcement officer from DHSS. I think that certainly hospitals are struggling with cost, but the cost of a law enforcement officer probably less than they're paying for a traveler nurse right now.
Representative Wheatley, you are recognized.
Thank you, Madam Chairman. Just a brief question. This doesn't include patients, right? It's just for outside visitors and families, because patients often scratch, bite, do hit, be out of disorientation and because of their illness. So this doesn't include patients, right?
Representative Reeder, you're recognized to answer the question.
I believe that clinicians who are in this space can recognize when it's a demented 80-year-old who lashes out, and that's not going to be prosecuted. But every day in hospitals and emergency departments, we have patients who or family members who have their faculties, who strike, verbally, physically assault healthcare workers. And those people who do that, even if they are patients, that's not right. And we should be prosecuting. That's what the law says. So if someone is drunk and runs over someone, we have no problems prosecuting them for drunk driving and vehicular manslaughter. But somehow, because you're in a hospital gown and you're acting out, we feel that that's an okay thing. I think that I would rely on the clinical staff and the judicial system to help adjudicate whether that patient had the capacity with which to do that. But we know that our staff, physicians, nurses are being assaulted on a daily basis, and we've got to do something to prevent that.
Representative Liu, you are recognized for a question.
Thank you so much, Madam Chair. I have a quick question. I understand how important it is to protect the safety of our healthcare professionals. And do you think it will be helpful or it's necessary to install metal detectors in our emergency rooms and hospitals? And I have heard from our doctors and nurses, and one doctor especially, like she mentioned to me that she had to fight with a patient who carried a knife into the emergency room. And a police officer on site may not be able to stop that. But any comments from you would be very helpful. Thank you.
Representative Reeder, you're recognized.
I think best practices in emergency departments is to have metal detectors. When we've looked at studies, patients actually prefer that because they know that their safety is benefited from that. We can certainly come back next time and think about how we would do that and install metal detectors in hospitals. The challenge is for many hospitals, there's dozens and dozens of doors by which people can enter, and so it does become a bit problematic, but I think that that's a good point.
Okay, we have a few more questions from committee members. I just wanted to recognize the clock. We have a hard stop here about 10 minutes till, and we have one more bill to get to, so the members of the committee are thinking about time. Representative Cunningham, you are recognized for a question.
Thank you, Madam Chair. Dr. Rita, and I probably said that wrong, Representative Rita. I'm a nurse, and I have been hit, and I have been bruised and all of that by a patient that was delirious, suicidal, and was trying to escape. But we did have in place security. But by the facility being so large, the person couldn't get there. If you got 10 floors, they can't get there fast enough to prevent it. So I know that things are in place in the larger facilities, but it sounds like it all sounds good, but the costs keep adding up with it. And so I'm trying to figure out where's all this money going to come from with us having shortages in every aspect of the workforce, not just healthcare, correctional officers, sheriffs, all of them. We have a shortage. And how are we going to do all of that to enforce something that some of the facilities already have in place? Now, I'm not saying they're experts in that area because law enforcement are supposed to be, but I don't see how putting one person in a facility is going to cover all that area and going to be such preventive in their actions.
Representative Reeder, you're recognized.
So the bill says that the hospital has to do a security assessment. And for some small hospitals, one might be enough. For our hospital, and I come from a big health system, our police force has 100 full-time officers, 50 part-time officers, making our hospital police the 10th biggest police force east of 95. This just says that you have to have one. What my hope and belief is that when they do the assessment, they will say, these are the things, steps, not just personnel, but other policies and procedures to ensure that our workers are safe. Again, 71% of the non-fatal injuries workplace are in healthcare workers. So the patients, the people who are taking care of us suffer injuries more than any other industry that's out there.
Thank you. Representative Blackwell, you had a question?
Just a quick comment, if I may. The Joint Health Oversight Committee could take a further look at this, the issues that Representative Lambeth raises about the small hospitals, the rural hospital, the issue that Representative Cunningham raises, help some of the smaller hospitals even with grants or appropriation. I just think that's something we could do and maybe take some action on in the short session.
Representative Reeder, do you have a comment?
No, I appreciate that comment. What I would hope and ask the committee to do is to pass this forward. We continue to work with stakeholders to figure out how best to get this implemented.
Thank you. Any other questions from the committee? Seeing none, Representative Purtle moves for a favorable report to the PCS for House Bill 809, unfavorable to the original bill with a serial referral to House rules. All those in favor will say aye. Aye. All those opposed? The motion passes.
Thank you very much.